Good afternoon, everyone. Michelle French here at Run on Heart Personal Training. It's Friday, the 12th of October, and it's Friday Fitness with Michelle. I am coming to you in a little different way today. I'm experimenting with something that one of my wonderful clients suggested, also a very astute businesswoman. And so I'm attempting to work with this. I'm going to try to master the art of PowerPoint and see if when we have more structured types of discussions, that might be a way to go as well. But I'm trying this week. Feedback at runonheart@msn.com. Feel free to subscribe to the YouTube channel. It's free. And I'd love to hear from you if you get a moment. Now, as we all know, it is October and it is Breast Cancer Awareness Month. So I feel, as I did last week, compelled to, because it was flu season and time for the annual flu shot, to sit down and go over a few simple factoids with you. Here we go. Did you know that breast cancer affects both men and women? The 2018 diagnoses currently are running at 266,120 for women, and for men 2,550. Lifetime risk for women by the time you're 70 is 1 in 8. Reducing your risk. This information, by the way, comes from Mayo Clinic, a trusted source. Limit your alcohol to less than 1 drink a day. Don't smoke. Goes without saying here. With everything that we know about how tobacco affects our body and the types of things that can happen to us over the course of our lives, just don't smoke. Control your weight. Be physically active. Here we go. Here's an interesting little way I look at this. 75V over 150M by 2 times W. Here we are. 75 vigorous minutes a week or 150 moderate cardio minutes a week by 2 strength training sessions a week. Limit your dose and duration of hormone therapy. Some women use hormone therapy to get through some of the symptoms of menopause. It's not meant to be a long-term thing, just a short-term thing. Breastfeed. Avoid exposure to radiation and environmental pollution. Breast cancer. Signs and symptoms. Lump and mass in the breast. Swelling. Skin irritation and swelling. Breast and nipple pain. Nipple retraction. Redness, scaliness, or thickening of the nipple and skin. Nipple discharge. Risk factors. Here we go. Being a woman. Getting older. Inherited BRCA1 or BRCA2 gene. Here's a neat thing. Not a neat thing, but something that you might find very interesting. 70% increased chance by the age of 80 if you have either one of these 2 genes. Family history. Personal history. Dense breast tissue. Other breast conditions. Early start to your period. Menopause after the age of 55. Chest radiation and exposure to synthetic estrogen. We have a lot of information here. Lifestyle risks. Drinking alcohol more than 2 per day increases your risk by 20%. Being overweight or obese. Not physically active. Not having children. Not breastfeeding. Hormone therapy after menopause and using birth control. Screenings. 3 different types. Mammograms. Currently, the recommendations are for every year after the age of 45. Breast ultrasound. Those are useful in finding change. They can determine whether a mass is solid or liquid. And an MRI. This is really good for high-risk people. Also, it's very good for measuring the size of a tumor. So, I've imparted a lot of information from you. I've brought it to you on a pad in this format so that you can look at it again later. Hopefully, you will find it helpful. Please, again, any questions, direct them to, or comments, runonheart@msn.com. My name is Michelle French at Run on Heart Personal Training, Fitness, and Nutrition. Have a fabulous weekend. Bye-bye now.